Dental Podcast,
where real people, real stories,
and real life come together.
This is the Life and Dentistry Podcast.
Hello, everyone, and welcome back to another episode of the Life and Dentistry Podcast.
Hey, everybody.
What's going on,
What's
America? And the rest of the world.
How y'all doing?
Man, so patriotic. So patriotic, Joe.
So for the radio listeners, I'm waving this little American flag that I got. I think it like the Chicago Midwinter at the Army booth. Keep it on my desk.
Oh, that's where you got that. I was with you when you got that.
Yeah, we got all that free stuff, remember?
I'm not a very good American. I don't know what I did with it.
I don't remember that trip, Joe, because remember me and Sky didn't get invited, so.
Oh, yeah. The
Yeah,
peasants
we didn't
didn't
want
get to
Yeah, I know. Oh, Joe and Cole with their secret society.
Yeah,
Oh,
you got to be good enough.
We're just going to make a show and call it The Secret Life of Joe and Cole.
Y'all make that sound kind of weird.
Joe and Cole, they'd been working at a private practice for a year, and I didn't know anything about it while in dental school.
Did you really not know?
I
I had no idea,
How'd
and
you
not
not
until a
know?
year later.
Man.
No, you didn't. You didn't. You didn't tell us. You didn't tell us, Nicholasville boys.
Oh, man.
Have
we
we
got
ever
left out
told
to
our
dry,
audience
man.
about that? We've never really got to talk about doing that, have we?
I don't think
Oh
we
man.
No, I don't think
we
so.
hardly mentioned it.
Actually, come to
Probably
think of it, I don't think I ever told Scotty about it, did I?
I think we just covered that. You were busy
Yeah,
waving your American flag.
I just kind of heard it through the grapevine.
So, yeah, tell us a little bit about that, Big Joe.
It sounds a lot cooler than it is. Some trailblazers before us, a couple years in dental school, found a way to kind of sneak the system to where you could actually practice as a dentist while you're in dental school. So you're still like covered by the university, and they
Yeah, we
found
did
a
nothing
school.
illegal. We'll just get that out there. Nothing.
Yeah, it was totally legal.
We weren't out there writing prescriptions or anything like that.
No, not during the week. So, no, so they
Only
kind of
on-
laid out.
only on Sundays, right after church.
Yeah, they laid it out for us, and I caught wind of it. So, the summer before going into fourth year, I reached out to the guy, the dentist that lets him do that, and ended up developing a really good relationship with him. Kind of became a good friend of ours, and I went out there to shadow. And I came back and I told Cole or somebody, I guess it was Cole. I was like, yeah, I'm thinking about working in this private practice through school. It's a little extra.
That was when the secret society was Joe and Joe only, and then he let Cole in.
I let everybody in. Anyway, I get a call from the doctor, Larry Herman. He's like, hey.
And then Cole was like, "Just don't tell Scotty or John Wesley.
He said, hey, do you know Cole Haggerty?
They're not good enough."
He was like,
Cole Haggerty.
Cole Haggerty called me, wants to be some dumb A dental student, wants to be work for me. I said, yeah, I know him. Anyway, he let Cole on.
Yeah, that's actually the first thing he said to me when I called him on the phone. He cussed me out, and he's like, you must be that dumb dental student who wants to come work with me. He's like, all right, I'll take you to dinner.
Oh man,
That's where it all started.
Cole, what do you think was the biggest thing you learned working in that office during dental school?
Biggest thing I learned, I would say, I don't know. It's between some of the medical stuff we learned, or it actually had nothing to do with dentistry or the finance.
Yeah, he taught us a lot about finance.
Yeah.
Something that's been helpful to me that I've learned. I was talking to our hygienist about this today, about the different philosophies between different dentists in the practice. And one of the hygienists actually was under the they kind of feared that dentists are kind of being trained, or a lot of dentists think like they kind of make their decisions off of money and like kind of, do things that maybe don't need to be done. And I'm not saying there's not people out there that do that, but I was kind of explaining to her how I came up with my treatment philosophy. And it was at this guy's practice, he watched a lot of things, and he was almost, to him, like doing a crown or taking out a tooth is like he failed his patient in a sense because they have that big cavity or they need that done. So he would let things go sometimes and wouldn't necessarily treatment plan what was there. And the patients that were there over time actually are missing a lot of teeth, and they kind of have large decay. So through that experience, it showed me, like, if it's there, you don't really need to watch it because you're not – what are you really watching? Like, if it's there, it's there. You might as well fix it when it's small and,
I agree.
you know what I mean? Like, get better oral hygiene and try to fix it.
Yeah, so you're saying it wasn't a good thing you saw, it was a bad thing.
It was – I'm thankful I saw it because it helped transform my philosophy in dentistry. I kind of got to see the end result of watching things over time.
Right. Which it was – I mean, it was nice. The guy let us work with him. He taught us a lot. He's the type of guy that he took us out to eat all the time. He would have us over to his house. We'd talk investing and stuff like that. Yeah, we still talk to him all the time. He texted both of us just the other day. And so he's a great guy. I love the guy to death.
Best guy I've ever met.
One of the things is dentistry to him is not like his big moneymaker. He's into investments and all that. So he sees a lot of Medicaid. He does work for free. A lot of his patients, they come to him, and through conversation with him, that's one of the things they appreciate him about him is that they're not just coming in there and having teeth extracted and, crowns left and right. They're like, I just love the way Larry, he'll just patch up my teeth and I can keep my teeth.
Yeah.
And I'm kind of looking at it from the perspective of, well, it's really not helping you in the long run. If you keep patching up this tooth and then it cracks, the tooth is gone. Where maybe if you would have just gotten a crown from the beginning instead of 10 appointments of fillings, then it actually probably would have been more beneficial for you in the long run to just go ahead and get the crown. So, yeah, I mean, it was a good thing to see that, hopefully we can kind of see stuff like that in advance and help our patients in a way that they will see what we're saying as far as getting certain treatments done that will protect the tooth in the long run.
Exactly.
Rather than just making little shortcuts and taking little bitty steps that adds up financially and ends up in a worse position in the long run.
That's what I was explaining to somebody today. It's like in our heads, we get too emotional into it. And especially for me and the practice I'm at, it's like our community, you're invested in the patients, their financial situation, and, they've been in this practice a long time and they know the doctors. So it's like you feel almost emotional, like you can't really treatment plan these crowns and to redo all these fillings. It's like, oh, it's just a little stick, or it's just something little, that open margin's not a big deal. But ultimately, wouldn't it be better to fix it now than to fix it later when you're looking at a root canal or an implant?
Right.
Yeah.
So what are
I agree.
What are y'all seeing in private? I mean, I think Joe and I had this conversation this week. What are y'all seeing as far as in private practice? If you say a patient needs a crown, okay, let's say it's either they have just a huge amalgam that's, covering 2/3 of the tooth and the margins aren't great, the margins are open on it, and you say this tooth really needs a crown, or say, it's a large filling that has recurrent decay, like you really need a crown. Have y'all seen enough yet to say, I suggest a crown to these patients and they just say they don't want to fool with it or can't afford it? Or are the majority of them saying, okay, I can see that, I don't want my tooth to break, I'll get the crown? What's been y'all's experience within these first couple months that y'all have been practicing?
In mine, most of the patients have actually accepted the treatment. And really what's helped me out is having access to an intraoral camera, because I can explain it to them all day and try and show them with a mirror. But as soon as I take a picture and put it on that screen and actually, explain to them what's going on, I'd say 95% of the patients have agreed to the treatment. So that's, that the intraoral camera has been huge.
Dude, the more and
for
more
me.
I hear about those intraoral cameras, it really is good.
It's just something about it. It's like as soon as they see it and they can actually look at the tooth while you're explaining what's wrong with it, it's so much easier to for patients to accept that treatment plan, because then they know you're not BSing them. They understand that, look, that's something wrong.
It
I
reminds
agree
me
100% about the intraoral camera, Scotty. That's been huge, absolutely huge.
Yeah.
And I've seen how maybe not every situation. Let's just say, for example, I've had a cracked tooth. I mean, let's say it's a pretty big crack. Like they're not having symptoms with it, but it's like, you could probably drive your truck through it. It's so big. When I've just said something to them about that, and I didn't show them a picture, it's a whole lot harder to explain. There's a crack on your tooth because they can't feel it, but when they see it, I mean, it makes a world of difference.
It does. Yeah.
Yeah.
It reminds me of actually what Gary Takish said during our conference, the Life and Dentistry conference in it was beginning of this year, where he was actually saying, take those pictures and put it on an iPad and give it to the patient. It's nice to have it up on a TV screen where they can see it, but what's even better is to have something in front of them that is actually in their hands that they can zoom in on and kind of swipe back and forth. I mean, I haven't had experience doing that, but he speaks very highly of doing that.
Yeah, that's true.
I could see that working too. And to add to that, Cole, I'd say the other 5 to 10% that don't accept the treatment, I approach it from the fact that I'm like, I'm gonna tell you the best treatment and exactly what you need, and it's ultimately up to you to make the decision. But it's my duty to let you know what needs to be done, and just as long as you're aware of it. And these are the circumstances if you don't accept the treatment that would possibly happen. That's how I've been approaching it.
It's good you bring that up, because I was really the first part of this week I was really kind of struggling a little bit in kind of who I was as a new dentist. I felt like I was trying to be too much like the two doctors that are there, which is good in a sense to kind of fit in, but I also was we were trained the way we were trained. And when it comes down to it, your job as a provider, as a healthcare provider, is to diagnose what is there. Take everything else out of it. You have to tell them what you see and what is the ideal picture of health. And I think for me, I get caught up in,
that's right,
just like I said, the emotions of it sometimes. And it's like, man, I really hate to tell this old lady that, she's 82 and, she's got decay under this crown.
Yeah.
Gosh, I'd hate to make her pay another crown. But ultimately, it's our job to say it. You can't patch that thing all the way down to the root. You gotta do it sometimes.
It's just like, I mean, for some reason we don't look at what we do in the same way as doctors. I guess in a lot of times what we see is not as urgent as what medical doctors see. But if somebody's got an infection on their arm or something, or they've got something stuck in their arm, or something wrong with anywhere else in their body, then doctors are like, let's take care of it. And people are like, okay, yeah, I can see it. We need to take care of it.
Keyword is see it.
But then we don't see things the same way for some reason in dentistry, to say, you know what, you've got decay or you have infection underneath that tooth. We got to do something about it.
But I think one thing, the reason why we don't see it that way, I think a lot of that has to do with how we, at least for me, how I perceive that the patient thinks about it. You know what I'm saying?
Right, that's what I'm saying.
Yeah.
What do you mean, John Wesley?
Well, like you just said, you can't patch a tooth all the way to the root, like to the apex,
Mm-hmm.
if a patient needs a new crown. But I know if you see someone who has, like, let's say they've got 4 crowns and there is recurrent decay around all those crowns, okay, but the patient has no pain, they have no idea they have a problem until you tell them that. Now, again, that goes to them kind of seeing it, but then it's like, for some reason, the dental side of things, if a patient is not feeling pain, it's like the problem's not really there. Like, it's just, and so, like, then you're telling them, well, you got to have this done. You're going to have to chart, it's going to cost X number of dollars. And they're like, well, I'm not in pain, which I'm not saying that happens every time, but I know as a general broad spectrum, that's kind of the perception, as far as dental health goes. I know for me, when I'm talking to someone, I may not need to think like that, but I do think about that. It's like, well, I know I'm probably going to tell them this, and they're probably not going to want it or either think they need it. You know what I mean? I guess it's like an appreciation level that's there or that's not there.
So that reminds me of this quote I heard. Not really a quote, but I heard someone say it. So I listened to a podcast called the Order of Man podcast, and it's like talks about like leadership and being a man and that kind of stuff. And they were talking about leading others and influencing other people. And they said, when you talk to someone, you need to say things how they need to hear it and not how you necessarily want to say it. And I think that relates to our patients a lot of times. Like, I say things how I want to say it, but not necessarily how the patient needs to hear it.
Like, you're saying not use medical terminology or what?
I think not using medical terminology, but also understanding the patient's attitude. I think my first couple weeks, I think I scared some people because maybe I was a little timid myself, but a couple patients were kind of fearful of the dentist anyway. And I kind of sprung some things on them in a manner that may have been too aggressive or not necessarily aware of kind of how they were feeling in that chair. Mm-hmm. So whether someone is kind of shy or bashful, I'm going to say things different than if someone, shook my hand and is kind of smiling at me, if that makes sense.
Yeah, it does.
What about you down there at the
Joe, I think it all comes down to the more confident I get in my judgments and my treatment planning, I've learned to be more direct with the patient and tell them, look, this is what's going on. This is what you need. Instead of, well, I think you need this. I think you need that. I think it's all about being more direct and being confident in what you're telling the patient. Yes. And I've noticed a huge difference in the way the patients have accepted some of my treatment. And I've had some patients that have kind of getting irritated and I knew that they wouldn't like what I was going to tell them. But when they would get irritated, I would say, look, my job is to take care of you. Your health is your best interest is all I'm concerned about, and I'm here to let you know what's going on and how we need to fix it. And that's how I've approached it so far, and it seems to be going really well.
I agree.
You brought up a good point, Joe. You said that you would say something different to if you had 2 patients side by side, 2 totally different personalities, you would say things maybe differently because you're having to think of how they're going to respond to it and how they're going to take it. Like, that is one thing which I can't say that, and I'm not going to say that dentists have the hardest job, and I'm not saying that, but we do have a pretty difficult job because when you sit down in that chair, you have to do the best work you can do, okay, because number one, the patient deserves it. You've got to make sure you do the most ethical job you can do, but also you've got to think like, and this is like a small detail, but like when you're resting your hand just doing a filling or something, you got a fulcrum, like you got to think, okay, if you're doing an upper tooth, don't pitch their lower lip. You've got to be conscious of every single thing that you do, how you're talking to the patient while you're maintaining this super high level of quality work, And there's a lot of professions that every profession you want to do high quality of work, but like how many professions, when it really boils down to it, like have a patient who is awake, who is fully conscious, and like, what I'm saying?
Oh yeah.
Mm-hmm.
No, it's you're right, and I think
That's the reason why. Oh, go ahead, Joe.
well, I was just going to add on to what he was saying about it being tough. Personality wise, like we only have, especially when you're doing like a hygiene exam, the time you have to make an impression on someone is 3 to 5 minutes, and and they judge the dentist on that short amount of time. So I think it's important to be aware of your mannerisms in that time period, especially as a new dentist. They're
Yeah.
meeting you for the first time.
Yeah. It's like you're constantly having to judge yourself. You're constantly, at least I am. I'm
Mm-hmm.
constantly thinking, okay, like, and I'm like even reevaluating myself when I leave a room. I'm like, and I know I don't need to do that, but I do. I'm like, okay, did I handle that right? Even when I'm going to the next room where it's like a totally new person, I'm washing my hands. I'm like, okay, I got to forget. And let's ramp it back up. That's an emotional struggle for me. I don't know about you guys, but
And that's the reason why I'm so mentally drained at the end of the day. Like I'm really enjoying it and I'm loving it, but I am dead tired at the end of the day, mentally, more mentally than anything, because you're constantly having to, you know, meet these new patients or go in and whether or not you're in a bad mood or not, or, constantly having to put a smile on your face. And like you said, when you're working on the patients, if you want to have good bedside manner, you've got to, or chairside manner at that, you gotta take into consideration the patient's awake conscious, and you're taking care of them emotionally while also taking care of their health, whatever you're working on it. And it's mentally draining after a while.
I got a question for y'all. One of the things that has been tough for me so far down here in the residency is, I'm in a new place, trying to get used to the materials that they use, the system that they use. And so you're working with assistants that have been there for a while. And we've kind of hinted on this before, but you're the new person, and you don't want to come across like you're dumb in front of not only the patient but also the assistants. I mean, you want the respect of the assistants. You don't want to come across like, you don't know what certain materials are. You don't know the way to do a certain procedure. And really a lot of it just has to do with, well, they just do it differently here. It's not that I don't, It's not that I'm clueless about what I'm doing. It's that y'all do things differently here. You use different materials.
Oh yeah.
There's going to be a learning curve there.
Yeah.
So I actually had
Oh,
it
yeah.
today where I was taking impression of implants, and there was different materials that they use. There's a different system they use to do it. In dental school, I always use closed tray technique. And I learned today that, especially with multiple implants, you get a better result if you do open tray. I had in my mind open tray was strictly for implants that are angled weird, but it's not just for that. So I had to stop kind of midway through the procedure and talk to some of the dentists there about steps to take. And so I've got to leave the room. The assistant's sitting there waiting for me to come back to continue. The patient's sitting there waiting for me to come back to continue. So that's one of the things that, at least today and other times, that's kind of been on my mind recently. So what have y'all done to kind of help that situation and learn how it's done in those practices, but at the same time come across competent to the people in the practice and to the patients?
Buddy, that was my biggest struggle when I started. And just for me personally, and I don't know, John Wesley and Scotty, y'all may have done it a little different. I just went in there humble as can be, and I still am every day. And at first, I was struggling a little bit with, am I being too humble? And, I was just a sponge. I'm learning from the assistants. I'm learning from the hygienist. I'm like, I want to learn everything about the office, what you use, take me into the room where all the materials are, show me the stuff, and then I would do something like when I did a root canal. They used a totally different system than I did. I'm like, just hand me whatever you would hand Dr. Bryant, and I'll use it. And that's kind of weird, but it's worked for me. And I was wondering about the confidence thing. You know, do they have confidence in me as a dentist and things like that? And I noticed what happens over time is there situations where you have to make a decision and only you can make that decision, and they look at you for that decision, and you make good decisions and you gain their respect over those instances. And that's slowly starting to happen. What about you guys?
Same for me, Joe. It's just taken a little while to kind of gain the respect of the staff. I've just tried to be as humble as possible. And again, they use completely different materials. Even the hand pieces look and feel different. And that's been part of, it's not that I don't know what to do. They just, like you were saying, Cole, they do things different. Same thing with endo. I did my first root canal today. They got a different system. So I'm having to pick and choose my words wisely in front of the patient, but still like come across like, okay, what would Dr. Darty use in this situation, or something like that. But the longer I'm there, the more, certain situations you do a good procedure, it turns out really well, or you have to make a decision on the fly and it turns out well. Little things like that, along with, just treating the staff good and being humble has gone a long way. And I can tell that, they're really starting to, not they never did before, but they're really respecting me now and really working,
And it's earned respect.
To cater. Oh, yeah.
I'd rather earn respect than demand respect. I would never want to demand it, but I would.
Yeah, definitely. No. That's right. That's right.
Humility, I think, is the word you guys both used. And I think that word by itself will carry a single, like even like a new doctor, a new dentist, very far in his or her career. Because, and you said it good there as well, Joe, like it's that earned respect. Like you want, obviously you've had the education, you went to dental school, but we all know nothing trumps like real world experiences and we're talking about, different products and, trying to get used to stuff. I'm sure I probably asked some stupid questions. Honestly, I know I have, but when I'd ask it, I would say, I know this is probably a stupid question. I would kind of like follow it with it and like, can you tell me what is this? Because they use at the office that I'm at, there's actually, I can't think of the other name. They have two different, impression systems. And what I mean by it is like the one that I use is the PVS, which is what we used at school. That's kind of what I'm used to, light body, heavy body. And so, but Dr. Andy is used to a different system. It's kind of like PVS, but I don't think it's Empress. Maybe that's what it is.
Impergum.
Or
maybe. Is that what's the
PVS mix?
What's that?
Purple? Is it purple?
Yeah, I think so. Yes, I think so.
Impergum,
which I think maybe it's like more moisture. It can handle moisture maybe a little better.
No, okay, you're thinking of. I know what you're talking about. Yeah, we never used it in school, but we use it sometimes. For Dr. Bryant showed me it. I forget what it's called.
Yeah, but anyways, like
all
that was like
listening to this will know all this material.
We're just talking about imprint.
Maybe.
I mean, I don't use it. I just know he uses it. But it's like
in me.
you just use the goo they give you, right?
Hand me whatever you would hand Dr. Bryant.
That's what I tell them. It works great.
I don't even take impressions.
I will. We do sometimes, but
yeah, I mean,
we've scanned all the crowns that we've sent to the lab, but most of them we just make the crowns in the house. So.
Man, I tell you, it must be good to be a Blanchard, man.
You want us to all bow down to the Blanchard God?
No, I'm just telling you why I don't. I don't have a
Like, I
fight
don't-
in the impression talk right now because I hadn't taken an impression yet.
Scott is like, well, we
Scotty's
don't
like,
take
yeah,
impressions.
we're years,
No.
we're years
Joe,
ahead of
I
all
saw
of you.
2 Syric machines in his
man.
office.
Yeah, that was just for looks. He doesn't know how to use them.
Oh man.
No, hey, another
They're
thing.
just coat racks.
Yeah, another thing I know you had on your mind, Joe, this week was how to correct an assistant. So, if there's something you want done differently that maybe I don't know, whatever it is, maybe I don't know if something specific happened with you this week, but I actually so we have 12 residents here. There's I think 13 assistants. And you know, when you've got that many assistants, some of them are better than others. And there's one in particular that I've worked with once or twice that just really is not good. And you know, it's actually one of my co-residents. He had a couple patients say, "I don't want to come back if that guy is assisting you," because he just very, very rough and is very short with patients, is not very welcoming, not very warm. And so, you know, you try to come up with ways to get the point across to the assistant, but you want to do it in the right way. So, I mean, have you all run into that where you want things? It's a little hard because it's hard for us as newbies coming in saying, "Oh, you know, I want it done this way or that way." But
It's
have you all
hard
run into
when
that problem?
when I'm still relying on them for advice. Like I'm still
Yeah.
relying on them a lot to help me, but at the same time, it's not that I don't want to say correct. I don't want to say it kind of. It sounds bad when I say it like correct an assistant. Just more like constructively, like educate on, maybe this is why, a contact has to be like this or a margin has to be like this or things like that. And not that I've necessarily run across, those specific instances currently, but I think it's going to be difficult, and it even is difficult now when you rely on someone for advice, but at the same time, you're trained as a dentist to look for different things. And when those things aren't done, the treatment's compromised, if that makes sense.
Yeah.
What do y'all think?
I think it's a good point. You made a good point there. Treatment compromised. I think that's kind of like that line.
Have
Yeah.
you? I mean, I know we all have like a really good good staffs and great assistants, but have y'all come across anything like that? Like to where you're in a kind of a weird position?
Well, right now, I have not, but at this point, I guess if we don't really have so the assistants that are there now, they're all kind of, I'll say, veterans of the office. Like they've pretty much seen it all and done it all. And so they kind of know, I guess, good work versus bad work, and good and bad ways to do things. Now I've done a couple of things different. Like I'm trying to think of an example. Nothing's coming to my head, but like I've done a couple of things in the office different. That was different from maybe how Dr. Andy would do things, but it's still the result is still the same. Like
Right.
the treatment does not change.
Exactly.
And we, I may have had a conversation, like just said, what do you guys think about this? I even asking their opinion, what do you think? But I haven't had that, I guess. And I'm hopefully I never do run into that, because the staff, are very good at what they do. But I can see that being a big issue if you've got somebody new, like if you're the established doctor and you've got a new assistant that comes on and is trying to kind of learn your system. You know what I mean?
No, I agree 100%. It is. You gotta tread. You're treading thin ice when I think, as a new doctor, when you rely on someone so much.
And I got a great staff that's been doing it for a while, and I guess for me, for the first week or so, I had to get used to the the new materials to kind of figure out the way I like to do things, because I had to figure out how these new materials work in my hands. But like this week, I've started to kind of get a routine down of what I like, and they've been really good about asking me, okay, in these situations, what do you like to give in as far as anesthesia? How do you want this handed to you? In what order? And all this kind of stuff. And now that I'm getting more comfortable with the materials and the instruments, I feel like I'm more in a position to where I've kind of started to tell them, I know you normally do it this way, but I would prefer it this way. But I say it in a nice way, and they fully understand, and they actually take notes, and they've gotten to where now where, they got everything set up the way that I like it as compared to the other two doctors.
Ours are really good like that too. They're really aware of each doctor and what they want, which is impressive. I confuse my assistants sometimes because I'm like, especially if I'm doing a posterior class 2 composite, freaking sucks, and it's the worst thing in dentistry. And sometimes I'm trying to like get things sealed, and I don't really know what I need, and I'm like trying to throw a little bit of flowable here and there, and they're used to someone knowing what they're doing or being efficient at it. And
golly, I took forever. And I'm yesterday. Like, I had it. I had an MODB on number 2 and number 3.
I feel like every day you've had an MODB, Scotty.
They almost every day, and this girl could not open up. Oh gosh,
not open up.
It was almost impossible to get a mirror and a drill back there to see. It was ridiculous. Man, I'm doing a little bit of everything, John Wesley.
Yeah. I will say this is
root canals.
Remember,
since we're talking
incision
about
and drainage.
Don't forget, he's scanning all of his crown preps. Okay, just
exactly. Yes, thank you for reminding me.
Impressions. He doesn't even know what impressions.
Posting cores.
Impressions are so 10 years ago.
Man,
I will say this. We're talking about
the past.
We're talking about assistants and all that. And I'm sure you guys
are so 10 years ago, by the way, not to cut you off.
So it's okay. It's okay.
You know what else is
please, Cole, go ahead.
You know what else is so 10 years ago? Georgia.
Don't even
Georgia football.
I knew he was going to say it.
Georgia football.
Go Dogs.
Hey, Tennessee got a big 4-star recruit from Georgia today or yesterday, I think.
All right.
John Wesley, what were you trying to say, buddy?
Preseason, what's Tennessee? Preseason.
Probably higher than Georgia.
No. Anyway,
I know Georgia's 15, which is about right.
That'll go down. All right. So, no, what I was saying was we're talking about assistants and all that. I'm sure you guys experience this. To me, it's the coolest thing, which, like I said, all the assistants at the office I'm at are veterans. They know what they're doing. It's like when I'm during a procedure, and I'm like not even – during, let's just say, for an example, we're doing a class 2 or 3 or class 2 composite. And I may, we're cleaning things out. I'm getting the mirror, Explorer, checking it, hand it back over, I'm checking it. It's like when I release a handpiece and I'm like, in my motion, I would be grabbing the Explorer. It's like they're already in the process of handing me the Explorer, and I haven't even said anything. Now that is so cool. And
it's magic.
And that they, I owe them a lot just for that fact.
John,
Scotty just burping in the mic. Doesn't even care.
Oh, my bad.
Gosh, man, we're live.
He's been breathing, snoring, burping, everything.
I'm not breathing in it.
Yeah, you are. You keep yawning.
Why didn't y'all say something?
You keep yawning. You're like,
we say something every time, man. Dang, dude.
People were driving to work this morning, and they're like, "This dude is freaking."
You know what? Every time I hear that, it reminds me of Mike Frymouth when we were recording in Moody's hotel room that night, and he's just like tapping on the mic and the whole time.
Boys, I got one last thing I want to bring up tonight. And I think it'd be I want to hear your feedback. At the beginning of this week, like Monday and Tuesday, I had a really bad day. And I don't know, when I say bad, I think it was more like a mentally bad day. My confidence wasn't there. for some reason, and a lot of it was because I'm really slow right now in clinic. I'm not seeing a lot of patients because I'm not in with a lot of the insurances, so things are just slow. I'm kind of sitting around a little bit, and for some reason, subconsciously, like when you're not doing something, to me, it makes my confidence not where it's at when I'm like in a rhythm. Well, I met with a dentist, a really successful dentist in another town for dinner on Tuesday night. And I was kind of telling him what I was going through. And he was like, dude, how long have you been in private practice? I'm like, yeah, about 3 weeks. He was like, for one, you've only been in this 3 weeks. Don't be so hard on yourself. And he said, something you're going to have to learn is you cannot let your production dictate your attitude. He said, because there's going to be times in dentistry where you're going to have really good production, and instinctively when you're producing and doing good dentistry, confidence, your morale is up. He said, but when it's not, you can't let your morale get down because every single person in the office, especially if you're by yourself, feeds off your energy. Your patients feed off of it. Your front desk, the assistants, hygienists, everyone feeds off that energy, and you have to make the choice to control your own day, not let your a lack of production get you down. Have you seen that in the short time you've been practicing?
It might be a little bit different for me, and I still don't know why exactly it is. I don't really have a whole lot of downtime. I'm pretty busy most days. Even if I have patients cancel within probably 20 minutes, a lot of times they've filled my schedule with something. So, I mean, I can't say I've experienced the downtime because I don't really have much downtime. But I have experienced just if a procedure doesn't go well or something, or you have a difficult patient and you get down on yourself about it and you're kind of upset about it. You maybe don't realize it, but your face shows that you're not really enjoying what you're doing. I had one of the assistants, I just finished up a patient this morning, and it was about 10 o'clock, and I was waiting on my other patient to come in, and one of the assistants came in and was asking if I needed anything, and I said, no, the patient should be back any minute. And she's like, you look tired. And I didn't feel tired, but when she said that, it kind of registered with me what my face probably looked like to her.
Mm-hmm.
And so I thought to myself, and I try to remind myself each time before I go in and see a patient to have a good attitude. Even if I'm thinking I'm in a good mood, I got to make sure my face shows it, because you can think you're in a good mood all day long, but if your face doesn't show you're in a good mood and your face doesn't show to the patient that you're happy they're there and you're happy to see them, and it really doesn't mean anything, So I haven't really experienced the downtime, but I have experienced trying to keep in the front of my mind to keep a happy face and a happy mindset.
That's exactly right.
Well, I can say I've experienced both of those, Joe. The downtime and, things kind of not, like what Cole's saying, not kind of going your way and all that. And I think I'd say probably everyone, feels that same way. Because when let's say you have a good day, whatever procedures you did and you did them well, and you're like, oh yeah, man, that looks dang good, and you're just pumped and hygiene is going well, and your people are in good moods, and back to back patients are just happy to see you. It's like you're just on cloud nine. And those days, and I've had days like where it's been like that all day long. So at 5 o'clock, I'm actually not emotionally drained.
Mm-hmm.
But that day is probably only a small percentage, in all honesty,
right,
of the majority of days. Not that the whole day's bad, but for an example, this past week I had one So it was probably going to be one of my biggest days that I've had as far as production, potential production. Okay. And there was 3 crowns that were planned. Okay. And I had some restorative in there, and I did 1 crown that morning. One of my crown patients, canceled. Okay. One of the restorative canceled. And then one of the other crown patients, one of her wisdom teeth was swelling up. So we didn't wind up doing that crown. And in between all this, a lot of the hygiene that day just did not go well for me. Like people just, how what we talked about earlier, it was not a good day. And so I ended that day like feeling like I didn't do anything. It was a wasted day. I felt down on myself. I was like, man, not that I was telling myself that I suck, but that's kind of how I felt. I'm like, man, I really just dropped the ball today, even though it was out of my control, which is kind of in your scenario. It's like it's out of your control, But I think we all experience that. I think we're going to continue to experience that.
I think so throughout our career. I think in different segments, if we don't choose to have a different attitude, I guess.
Yeah, and you've got Cole made a good point about your facial expression and how you might think that you're in a good mood, or you might know you're in a bad mood, but you're trying to put on a front. Like and that's what I was saying earlier about we've constantly, like every second of the day while you're at work, you've got to be thinking about, okay, how am I reacting to things? What am I saying? How is my facial expression? And that's to the staff, to the patients, to yourself. Like it's a constant struggle.
You're a leader.
It really
man.
is.
People look up, whether you like it or not, good or bad, as the dentist, the doctor. You're the leader, and the way you carry yourself is going to be a reflection of everyone around you.
Yep, it is.
Good stuff. We're
Really
learning.
insightful things.
Yep.
I'm glad to have you boys to hash through it all.
Yeah, me too, man. You guys are awesome. I look forward, genuinely look forward to like going and checking my phone in between procedures and look at our text message and see what's going on throughout the day.
Okay, so how about the last text message we got in the group?
Oh yeah, we didn't even talk about that.
Lewis at Implant
Yes.
Pathway, he just sent us a message with a picture of 6 implants that he just placed today in a veteran's maxilla
Cavity.
Yes. Dropped 6
Where else would he place them?
Depends on how much fireball they have down there.
All I know
Yeah.
all I know is Scotty would have just scanned the arch and they would have just dropped it.
They would have just dropped them right in there. They just would have magically appeared. Just bam.
So shout out to Big Lou.
Yeah, go kill it, buddy.
Yeah, man, doing big things, Lou.
The Implant Pathway right now with Justin Moody.
Doing big things, Lou.
Speaking of shout outs, I gotta give one of our hygienists a shout out because she listens to our show, and her mom actually works with John Wesley. Her name's Mickey, so shout out to Mickey. She's awesome, but she listens to our podcast.
Hey, Mickey.
Is her daughter Minnie?
I don't know you.
No, her daughter's Kate.
Oh man. Well, guys, this has been a ton of fun. Like always, I look forward to this every week. We're talking about the text messages and all that. I look forward to getting to vent to you guys, and I hope everybody that's listening, they're getting something out of it because I get something out of it every time. So,
lifeanddentistry.com.
That's right.
Hashtag
That's right.
Life in Dentistry. Hashtag blessed.
All right, guys. Well, like I said, thank you all for tuning into the episode. If you're not doing it already, be sure to follow us on social media. You can find us on Instagram and Facebook at Life in Dentistry, and on Twitter at Life in Dent. If you have any questions for us, you can send us an email to lifeindentistry@gmail.com. And if you haven't done already, be sure to head over to our reviews and ratings page on iTunes and let us know how we're doing, how we sound. And be sure to hit the subscribe button. That way you never miss another episode. Again, thank you all for tuning in. And with that, we'll catch you next time.
Peace.
The Dental Podcast,
Where real people, real stories,
and real life come together.
This is the Life and Dentistry Podcast.